Hello everyone. Today we will learn steps of outbreak investigation. It is very important to know what outbreak is and how to investigate it so that timely control measure can be implemented. Let's first define outbreak. When there are clearly excess cases of illness than normally expected in that population in a given area in a specific time, it is an outbreak. The term epidemic and outbreak often used interchangeably. How do we know the occurrence of outbreak? There are different ways through which we may come to know the existence of an outbreak. Through the routine surveillance, which include active surveillance, collecting health information actively, passive surveillance, observing routine data, and sentinel surveillance, where selected group or institution provide health data. IDSP integrated disease surveillance system or through variety of other sources of information like news, social media or even rumors. Once we decide to investigate an outbreak, we have to do it in a few systematic steps. The number of steps, order and content can vary and several steps can be done at the same time. But in essence, an outbreak investigation consists of confirming whether it is there, describing it, determining its cause, and implementing the control measures so that it doesn't spread further or happen again. Let's look at all the steps in more detail. The first step is confirming an existence of an outbreak to determine whether excess of cases than normal. To know that, we need to study the baseline data of that illness for that population and for given time. Then we can compare it with the current occurrence to see whether there is an excess or not. Sometimes it may happen that the excess of cases may be due to diagnostic error, increased lab investigations, recent change in the population due to migration, or increased awareness in the community. All that need to be ruled out to know the actual cause. Second step is to verify diagnosis. This is usually done by reviewing the clinical and laboratory findings. It is possible that action to control outbreak already been taken by local authority. To conduct outbreak investigation and conducting a house-to-house survey, we need to form team. Once the outbreak has been confirmed, the next step is to describe the outbreak. By describing the outbreak, we get to know who are affected, areas which are affected, and other characteristics of an outbreak. Let's take a closer look. To begin describing outbreak, we need to figure out who should be considered a case and who not so that we can found them all and start describing. Case definition is used to differentiate cases amongst normal. Case definition uses the criteria which need to be met in order to classify a person as the case. Generally, it consists of time, place, person, clinical and laboratory criteria, which needs to be satisfied to label a person as a case. Once there is a case definition, cases are looked for in a systematic way and information about the cases is recorded. This is usually done by using questionnaires and summarized by time, place and person. Let's have a look at each one of them because each of these provide useful insight into the outbreak. By describing the occurrence of cases over a time, we can look at how the disease has developed over a period of time. Histogram, popularly known as epidemic curve, is used where time is shown on x-axis and number of cases displayed on y-axis. There are two common patterns of an epidemic curve. The first is a point source outbreak. This happens when the outbreak is from a point source. For example, if there is an outbreak of food poisoning after eating a contaminated meat served at a restaurant, the typical pattern of this is a sharp rise in cases followed by a rapid decline. The other one is a propagated epidemic. This pattern is common in outbreak where the infection is passed from one person to other and the first wave of infection is source for the next wave. The typical pattern of this curve is a series of progressive peaks of illness, for example COVID-19. When place is used to describe the outbreak, it can provide information on geographical spread of disease and also identify if there are any clusters. Here comes the use of modern mapping tools. and geographic information system technology crucial in mapping and tracking outbreaks. Describing people who are affected by the outbreak, for example, by age, sex, occupation, and ethnicity, can provide useful insight into the disease. It allows investigators to find out the risk factor for getting disease, and that is how we describe the outbreak in second step. Figuring out what caused the outbreak is the next part of outbreak investigation. The information available from the previous steps may point out likely cause of the outbreak. This is also known as generating a hypothesis. Now, if the pathogen that's the cause of the outbreak is already known, then it can provide useful information to guide investigators to the likely source and mode of transmission. For example, in an outbreak caused by cholera, investigators would look at contaminated water as the potential source of the outbreak. If it's a food poisoning outbreak, it's likely due to contaminated eggs or meat products. However, if it's not very clear, investigators need to test and confirm the hypothesis that was developed. This is usually done with an analytical epidemiological study. The two most commonly used types of analytical studies in outbreak investigation are cohort studies and case control studies. The studies can determine how likely it is that a certain factor is the cause of an outbreak. In addition to the analytical epidemiological studies, an environmental investigation can also help confirm the hypothesis. For example, in a foodborne outbreak, the environmental investigation could identify factors like contaminated eggs, improper food storage, or poor hygiene standards that may have contributed to or caused the outbreak. Laboratories are very useful as they can provide microbiological information to confirm the hypothesis. And that concludes our third step of determining what could have caused the outbreak. Now let's discuss the primary goal of investigating an outbreak: control. Control can happen at any stage of the outbreak investigation and can be targeted at any step of the transmission pathways between the agent, host, and the environment. Control measures include behavior interventions like using bed nets to protect against mosquito-borne disease, medication like doxycycline for cholera outbreaks, vaccination like giving COVID vaccine during the COVID-19 outbreak, environmental measures like insecticide spraying during a malaria outbreak or improving water quality during a cholera outbreak, infection control measures like isolating infectious cases, wearing appropriate personal protective equipment, and disinfection of medical equipment to restrict further spread of the infection. Providing targeted and appropriate health education will ensure that those who are sick will know what to do to stop spreading the disease, and those who are not sick will know what to do to prevent getting sick. After control measures are implemented, there should be active surveillance to monitor the outbreak to make sure that the control measures are working. That was a quick look at the different ways that an outbreak can be controlled. Now let's talk about communication. This is an important aspect of managing any outbreak, large or small. Communication is about making sure that the accurate, timely information gets to the right people at the right time. This can be those who are internal to the organization or those who are external to the organization, like other organization and the public. Communicating to the public is important, especially to those who are affected by the outbreak. It allows them to adopt protective behaviors, helps with the disease surveillance, and reduce anxiety, confusion, and misinformation. The media can be useful partner and help us out for the great communication. Sharing information about the outbreak using online forums or scientific journals and describing what measures were taken that were effective and what lessons were learned can help others manage future outbreaks. Finally, once the investigators are satisfied that the outbreak is under control, it must be declared over. For infectious disease, this is usually when there are no cases after 2 incubation periods have passed. Alright, so this is an overview of how to investigate an infectious disease outbreak. We learned what is an outbreak, how it is detected, various steps to investigate it, and which are the measures which can be taken to control them. Recent COVID-19 pandemic taught us many things regarding outbreak investigation and control. It involves people from all the departments to control the outbreak and to prevent further spread. It also tests the patience and discipline of the people to implement the control measures. Hope you enjoyed this video. Don't forget to leave us like and subscribe the channel. See you in the next video. Thank you.